big beautiful bill Medicaid cuts, I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. I'm good with.
So, ma'am, I'm just going to start off by saying that as a physician, you are able-bodied and able to go to work 40 hours a week until you're not. Right? We are all just one illness or accident away from being disabled. So this isn't really the strongest place to start your argument, but continue.
Not an immigrant that I can't prove my citizenship to get free benefits. I'm good with that.
So, ma'am, I don't know if you missed the memo, but undocumented immigrants cannot receive federal Medicaid benefits because one of the documents required to apply for federal Medicaid benefits is a Social Security card. You need the Social Security number, and as their name would suggest, an undocumented immigrant lacks the documentation like a Social Security number to apply for and receive federal Medicaid benefits. So, continue.
All these changes for Medicaid, y'all talking about people going to be losing so much Medicaid. What about us? We go to work every day. We took our kids to daycare. My kids take her kids to daycare so that she can go to work. People need to stop just getting free benefits.
Well, since you only seem to care about yourself, let me as a physician explain to you how these Medicaid cuts are going to directly impact you and your loved ones, even though you don't receive federal Medicaid benefits. Now, just stick with me till the end because this is really important, okay? So the Big Beautiful Bill is going to cut around $930 billion from Medicaid, which is going to kick anywhere between 12 and 17 million people off of their health insurance. And these are American citizens. The reason I highlight that is because, as I mentioned before, undocumented immigrants are not eligible for federal Medicaid benefits. And I know you don't care whether or not undocumented immigrants live or die because you don't view them as people. So I'm just going to move that aside for now. And I don't think a lot of people realize that Medicaid funds a lot of healthcare in this country. A lot of systems like hospitals, nursing homes, and healthcare clinics, especially in rural and underserved areas, are heavily reliant upon Medicaid funding. So Medicaid cuts, almost $1 trillion worth, are going to be really, really detrimental, disproportionately so, to those facilities in rural areas. And what happens then is those facilities close. They can't stay open without the funding. And what that does is it exacerbates, that means makes worse, the chronic disease burden in that area and the healthcare disparities that already exist in that area. So that means people get worse. Their chronic illnesses get worse. And now the hospital that was once 10 minutes away from them now is 35, 45 minutes away, which leads to delays in care, and people can get sick and die. People can get sick and have to quit working and go on disability and unemployment. So unemployment spikes in these areas. And then that's going to also shift the burden to larger urban medical centers, which, even though they have more resources, they're still finite resources. And a lot of these larger academic medical centers are already struggling with budget cuts from Trump's NIH funding cuts. So they are already short-staffed as it is. And one of the major resources in these institutions is the healthcare workers themselves, who are already burnt out and tired from having to work a whole-ass pandemic. I know some of you guys forgot about that, but the healthcare workers haven't. So now you're taking an already stretched thin workforce that's burnt out and having them do more and more with less and less, which is going to lead to substandard care. It's going to lead to longer wait times in the emergency room, longer wait times for specialists, longer wait times for things like elective surgeries, and it's going to put more burden on an already overburdened healthcare system. And just because you yanked healthcare away from 17 million people doesn't mean those 17 million people just stop getting sick. Sickness still happens, and they're going to have emergencies and require emergency care, require hospitalization, because EMTALA still exists for now. We have to provide that care to those people. And if they can't afford to pay for it, the hospital, isn't going to be able to just eat that cost. So what happens is they shift the burden of cost onto health insurance companies, meaning that they just increase the prices for things that private insurance pays for, and that means your private insurance premiums are going to skyrocket as a result. So you're going to have to pay more for the health care that you're already getting. And because of the stretched thin system, the health care is just going to be substandard. And heaven forbid you have a sick older family member at home who would need care in a skilled nursing facility, because a lot of those facilities are going to close, and the ones that don't are just going to be overburdened and overrun and not have any space. So you're either going to have to hire a private aide or a nurse out of your own pocket to take care of your elderly loved one, or you're going to have to just take time off of work or quit work to take care of them, which is going to cause more financial issues. So you can see that this has a pretty big ripple effect, and it doesn't affect the freeloaders getting free stuff or the undocumented immigrants who are just stealing from us. But hey, while everyone's getting sick and dying and struggling to make ends meet, at least you can rest assured that the big beautiful bill is going to make sure that the wealthiest people in this country get their tax cuts, because I personally am willing to sacrifice grandma if Jeff Bezos can get his fourth yacht.